colleagues, seniors, and all those who work towards love with compassion. I'm really honored and humbled. In fact, I didn't know how I was going to reach yesterday from Nanded. The flights were getting delayed, but I just left it to Baba. Once he's chosen me through Dr. Sundaresan to and bestowed this humble honor, I knew he'd find a way and I'd reach in time. And that's how I could be here. And I chose this topic because I think today that is what is required, a care with compassion for community. So, at the outline, I would speak on the stalwarts, the reality of what's happening in medicine, making of a doctor, my thoughts on what should be done way forward, and some experience to share. But when I talk before you all, it's like taking coal to Newcastle because you've done it all, been there, done that. But how do we take it collectively to the nation and to the world where we believe Vasudhaiva Kutumbakam? So we've had stalwarts, whether it's Dr. B.C. Rao, Roy, Dr. Shanta. In today's day, we have Prakash Amte, we have Abhay Bang, so many people who are really giving their service to the society. And SSS, of course, serve all, love all, takes really the prime position. But the future is a challenge. How can we really serve all? Not everyone can reach our portals. Not We cannot reach every doorstep, how much ever we want. So the only way is to become force multipliers. Because today medicine itself is ailing. And as a doctor, I would say, what are the complaints? We all know public health is not improving. People are losing faith in medicine and the out of pocket expenses, which are increasing. I couldn't help putting the kidneys there because it's a CKD and I'm a pediatric nephrologist. If you look at the history of present illness, I think I needn't read this out, but we know it all. Their doctors are being beaten up, they're being taken to court. Patients are just not happy. So there's a progression. And what do we do here? So the diagnosis obviously is a multi-system failure, and we need to look at all aspects. So whereas we need to make changes in medical education, align our research to public health needs, rekindle passion to serve, move from illness to wellness. As I always say, illness, when it's an I doing something, it's only illness. It's only when we collectively work together, we move towards wellness. And use innovation and technology for affordable public health care. So, what is the making of a doctor? Are we doing enough? I think we need to question ourselves because we are the people who can bring about a change. There is a continuous loop of information to knowledge where students strive from one degree to the other, need to next to what have you, and MCQs. Nowhere is there the wisdom coming in. And like Baba says, do you learn only to earn? Are we questioning our students that? Who will instill these values and sanskara into our students who go into it only to achieve a degree? I think that is what is ailing. So, what do we need to do? Today, it's a triangle. Education is happening in medical colleges, patient care is happening in our public hospitals, public healthcare systems where only the poor go. People want government jobs, but they don't want to go to government schools or government hospitals. Why is it so? Research happens in DBT and ICMR labs. The three don't talk together. And this is a slide I shared with the Honorable Prime Minister when I went on to this Innovation Council. What we need to is align these three and put them all under one roof. Shouldn't every college have a local flavor or a USP? I mean, we spoke in the morning of the excellent USP that is there of the Sai service. How can we take it to every college? Is college just a building? Is it just opening infrastructure, putting in some equipment and you have a medical college? No, where is the local flavor? Where is the community? Where you can pick anything. There are colleges, AFMC, Wardha. Why can't we bring that in? Is something that I'm fighting for. Baba says, be like a flute, hollow, no ego, straight, righteous and honest, simple, like a bamboo reed. But where does this reach out to the young students? Some of us are lucky. And today, I am here because I was lucky to be instilled these values. My mother was a s- devotee of Baba, and we grew up in Bal Vikas. So somewhere the value systems have to be instilled when you're young. But if they're not, everyone isn't lucky enough, I was saying today. But then can we reach out to the community and all contribute by catching them young? Should admission to medicine is the question I'm posing repeatedly to all people, and we need a collective word that medicine is not just neat and MCQs. It's very not neat. You need aptitude, attitude, altruism, temperament, psychometric skills, soft skills. We assess them nowhere. What we can, I feel, where we have taken up this case, and I think a force multiplier would be required from community to catch them young. 12th standard, when they're really waiting for their admissions, use that time. Could we give them a capsule today with digital technology? Everyone can. Can we make it compulsory? There's a gap between admissions and 12th exams. Culture, sociology, spirituality, Indology, volunteer in healthcare service. Let them know what the problems are. Because once they get into the rut of the degree, even the ATCOM model is just a tick mark. Electives like digital technology, integrated wellness, yoga, Ayurveda, even arts, theater, and medical humanities. We've lost it. So, with that in mind, I mean, this is the model that I've put up to the government also. And I'm just strictly going through it because we have such models, just the way SSS has a model of public health care. The Armed Forces Medical College, where again I was lucky to be ingrained in the value system, where we have a certain way of from selection right up to becoming the administrator. We are taken to different skill sets. We are, I can say, brainwashed to think of nation first. Where can we do this with our students? I think time has come, we need to, because science, while they learn the science of medicine, we need to just convey to them the importance that finally healing is an art. So we need the left brain and the right brain joining together. There's no time in the curriculum to get in besides science, knowledge, reasoning, logic. Where comes language, religion, family, art and culture, spirituality? I think unless we have the corpus callosum, which is strong enough to bind your left and right brain, we won't get there. So, what did some of my experiences? I thought, let me try, and it was a huge success. In the armed forces, when I was the dean, we started celebrating like family every cultural festival where people talked about it, put it in their way, make reels, get back to history, and they enjoyed it. I'm sure some of them may have got stimulated, or having a chat and motivating them over a tea at the dean's house. So, this is the Gurukul system. Doing that, I had a long journey from 78, where I joined the Armed Forces Medical College, going on by 21 to retire as a Lieutenant General, and then get on to, at the crossroad, jump into a second challenge because I felt we need to start with the health universities and we need to make that difference. Can I do my two bit? Can I be that little squirrel that helped build Ram's bridge? And that is why I took this up with the challenge, because there were value systems in me. Nation first and always is what a soldier is taught. And along the way, it was a huge learning journey. So, with that, we started certain changes, which I hope to convince and make it a role model that it goes. Due to paucity of time, I've not covered everything, but I'd love to share because I feel perseverance is hard work you do after you get tired of doing the hard work you already did. So, after 39 years, I moved into this. All of you sitting here have had the same calling to come back, to give back, to do more. Because the more wisdom you have, the more you can give back. So therefore, we started with a vision document, and I think this is what each one needs to make. Baba has taught us that. He would announce this is what is needed to be. We need to have a perspective plan. So we did that at the university, and it was an extremely useful moment because I could not, if I'd gone there as a general, it would have broken the system. I had to bend it without breaking it. So I had to learn a lot and change a lot to get the people and the colleges to transform slowly and bring in value systems. So we did an analysis, put in almost 300 things to be done over 4 years I finished 3.5. I finished in October. I'm extremely proud to say together, hashtag MUHS Parivar has achieved 100% of the targets. So a small, thank you so much. A small initiative that I started was SIP. Everyone knows SIP. It's a structured investment plan. So I got all the colleges together and said, can we have, it is my structured investment plan for the future. So I started a scheme called Summer Internship Project, which was different. It was not doing your own pathy. It was going and me going into the world, and we identified first year 24 institutions. This year, we've gone more than 100 institutions, more than 1,000 students who went and worked in labs, who went and worked in Panchakarma centers, from allopathy, from dental, from physiotherapy. They all integrated because the bottom line at the university was let's work together without spread, moving apart in our own fields. There are too many silos. So we have approached it everywhere as an integrated approach with the Ayush system, the dental system, the physiotherapy, all coming in holistically. Public outreach and health camps have been continuously so that students learn. Though the NMC did bring out a family adoption program, most colleges do it as a tick mark. So we are trying to really reinforce it. It doesn't matter because most colleges are in urban areas. There are no villages to adopt. So there's no place that they can really go. The uh, urban slums, they're not interested in meeting these kids who go there. Our research, we amended. This is just one of the projects where we adopted 18 tribal villages, which were identified by the tribal commissioner, and put them and sent out teams of children just to go and talk to the villagers to understand what's going on. And now the government has asked us to help draft the tribal health policy. So this is taking research to the grassroots, going down to the community, finding out problems and finding solutions. We put in a Disha as an incubator because we felt that we need to encourage entrepreneurship where people can go beyond their own and innovate. But I think the most important is with mushrooming colleges, we are finding it difficult to find faculty. So we have to, just the way COVID taught us, we hope to take digital technology to the next level. So we've started our LMS, and I think health universities, colleges, and institutions like our specialty hospitals, if they can reach out, and you're already doing the whole thing, but telehealth and digital technology, conducting classes, conducting lectures by the best of your faculty could be a way forward to reach many, many students. So we've also given digital libraries, so every student gets it on an app, and I've got 80,000 students every year. So it's a huge number. We had to reach the unreached. The same thing, the green campus beautification, you'll see just the philosophy that was shown here today morning. We've created lakes out of absolute barren land, and we have the sensory garden, the Samvedana Path, so that students learn with the complete thing. And the last thing we've done is now to go ahead in it, established a Section 8 company. I was just telling Madam there, called Chakra, because we felt Chakra is there in my flag. Chakra is there in Ayurveda, which tells us the strengths of ancient wisdom. And Chakra is an acronym for Company for Health, Applied Knowledge and Research with Autonomy. And we've set this up with verticals to take this ahead for research and health for community is the caption for it. And through spokes, we hope to revive and resuscitate the colleges and take it further. So I think in the end, I would like to say that we all here in this hall have found our ikigai. But can we get help hundreds and thousands of others in the nation, in the world, who do not find a purpose? Can we reach out to them and help them because our country needs us? We need to take it and scale up this model to take it to everywhere, take ownership of our entire country, our entire nation, and ensure care with compassion. And for that, I think the young generation needs a map. They need good mentors like you all. They need an attitude and a passion beyond Google Maps. So I think only together we can move. Om Sahana Bhavatu, Sahana Bhunaktu, Sahaviryam Karvavahe, Tejas Vinavadhi Tamastu, Ma Vit Vishavahe. With that, I'm really honored and humbled to have had the joy of serving. Bhagwan has always said, work is worship, duty is devotion. And that's been the mantra. And he really bestowed his blessings on me to serve in three roles and reach the pinnacles in each as a doctor, as a teacher, and as a soldier. Sairam, thank you so much for a patient hearing.
Thank you, Lieutenant General Dr. Madhuri Kanitkar, for that deeply inspiring keynote address. Your words have beautifully reminded us that care without compassion is incomplete. I now request Dr. Rita, HOD of Cardiology at Whitefield Hospital, to present a token of our love and gratitude to Dr. Kanitkar. As a leader, teacher, healer, and soldier, you have shown us that strength and compassion are not opposites, but companions. When the organizing committee, comprising the heads of all the medical institutions under the Sri Sathya Sai Central Trust, led by Dr. Sundaresh, first sat down to draft the conference schedule, they were all acutely aware that they were attempting the impossible. The scope of the Sri Sathya Sai healthcare mission is so vast, its dimensions so diverse, and its depth so profound that capturing it all within 2 days felt like, much like the Hindi saying, Gagar mein sagar bharna, trying to fill an ocean into a cup. Each topic here is worth of a conference of its own. Each speaker before you carries decades of experience, wisdom, and insight, far more than could ever be conveyed in the brief time that's allotted. Yet, for want of a better alternative, they have humbly structured this conference in a way that allows us to touch upon as many facets of the divine mission as possible, even if just as a glimpse. We therefore offer our sincere apologies to all the speakers in advance for the constraint of time, not the value of your message. The conference has been thoughtfully organized into 4 thematic sessions, each focusing on a distinct dimension of the Sai ideal healthcare model. The day one, session one, that is currently on, is themed His Work, the Divine Heartbeat of the Temples of Healing. As we begin the thematic session, we turn our attention to the heart of the mission, its origin, its structure, and the service models. This session takes us through the journey of how Bhagwan Sri Sathya Sai Baba's divine mission manifested into physical healing spaces, what we call them temples of healing, from primary hospitals to state of the art tertiary hospitals, offered entirely free of cost, yet delivered with the richness of love, dignity, and grace. We will also witness how this divine heartbeat continues to pulsate through the hands and hearts of doctors, nurses, support staff, and volunteers, all serving with sacred reverence. Since the world is currently buzzing about an Indian astronaut venturing into space after several decades, allow me to borrow a metaphor from the realm. Just as every space mission has a mission control, the Sri Sathya Sai Central Trust stands as the mission control center of the divine healthcare expedition. With Bhagwan at its radiant core, the mission navigates the vast healthcare cosmos, guided by the GPS of the 5 cardinal principles. It now orbits steadily, self propelled, sustained by divine thrust, and moving gracefully beyond the gravitational pull of worldly constraints. Let us now explore the 4 key dimensions of this system: primary care, secondary care, tertiary care, and outreach care, presented by those who live and breathe this mission every day. We begin with the foundation, the primary health care, where the first touch of healing often begins. To guide us through this lift off, we